Hi, I'm Dr. Lavanya. I'm a physiotherapist at Even.
I'm Dr. Ramya. I'm physician at Even.
Priyanka Khandelwal, Chief Nutritionist at Even Healthcare.
I'm Swati. I work as a clinical psychologist at Even.
I want to be
Exactly.
pampered and celebrated every single day. So I guess for me, one day doesn't really take a precedence.
Yeah, I think I agree with Lavanya there that even though it's good to have a separate day where there is a little bit of more importance given, but yeah, every day if it could be, a celebration where everybody sort of values, respects, understands, acknowledges, nothing better than that.
Yeah.
Who do you think should go first?
Why are you pointing? She'll go first.
Because she's gone through this everything.
No,
Now
that's
she's
okay.
able to answer it.
Priyanka will go first.
Haan.
Yeah.
Chalo,
Chalo,
come on.
Let's do
Not
this.
a good idea.
Oi.
Yeah, it doesn't look like a good idea for Priyanka to start.
Can I do that?
वो आ रहा ना बाहर आराम से. Take that off, yeah.
It's okay.
Women are more likely to be
Diagnosed.
diagnosed with anxiety and depression. Yes, for sure. Because that's the way the woman is built, with so much of, different hormones into the system, and obviously little bit of tweaking with it also causes quite a lot of changes, which gives anxiety or depression for sure.
No, actually, there is well-established research on this that women tend to be diagnosed more with anxiety and depression, while men tend to be diagnosed more with substance abuse, antisocial disorders.
Habits, yes.
And the reason behind this is that women tend to internalize more, because of which they withdraw, they get into distress, they feel lonely, while men are more overt. So they are more impulsive, more, aggressive with the whole set of emotions and their thought processes. So that's why this difference arises.
Yeah, but I think there are certain exceptions also. Like social factors definitely, contributes a lot to anxiety and depression. There are men who have experienced anxiety and depression. Maybe women have, have overcome that very easily.
The point is, all of us go through anxiety and depression for sure.
Yeah.
But when it comes to women, it's kind of like highlighted, saying that, hey, you know what, you're feeling this too much, or you're probably not feeling that too much. Or
That social thing comes
Yeah.
too strongly, I guess.
the plus side of it is, at least women are telling this up. I feel even men go through this a lot, and Papa, they don't even
Yeah, they
talk
don't.
about
Right,
it.
right. That's true.
I guess
Yeah,
we
like-
should just look at these as men and women. Say better
Yeah.
is that you look
Yeah,
at it
yeah.
as humans
Yes.
and just
Agree.
take it not based in gender.
Acha.
Hi, it's just.
Yeah,
This is
that's
how
how
it's
we build.
supposed
Yeah,
to be.
you have to keep building
And then it falls.
over. Oh, wow. Can you see
Was this
Ambani's
allowed?
house
Did you
there?
just.
Was
did
this
the
allowed?
Orientation, is this allowed? Isn't this cheating?
This is super cheating, Lavanya.
Arey!
It's like.
It's like I actually cheated. Look at that. Lifting weights makes women bulky. So
You
much.
better keep it
Yes,
back.
you do.
It's like if you're not able to open the door, just till the entire painting.
So this is like the apt question for me because being a physio and an exercise physiologist, I feel while people think that if women lift weights, they end up looking a lot more like men and having more bulked up deltoids and bulked up biceps. While it might be true for a few females because they might have that kind of genetic predisposition for it and hormonal support for it, women don't necessarily always get that as bulky as men. But in general, strength training has its own benefits like increase in the bone mineral density. Bone mineral density is how strong your bones are. So good muscle mass or a good section of muscle in your body in turn dictates how good your bone mineral density is as well. It lifts your mood, it reduces the body fat percentage. But body fat is mainly to do with nutrition, and I think Priyanka will be very
So
much
you mean
like
to
that.
say not lifting weights will make women bulky? When you say
In a
about-
different way,
Yeah.
yes.
Yes, I agree on the really bulky
Really,
one. I think it can.
Yeah,
I
bulk
agree.
in terms of horizontal width, yeah, definitely is through not lifting weights.
Even if a woman does get bulkier or looks muscular, there is so much stigma attached to it, isn't
Agreed,
it? Women
agreed.
themselves are like, no, I don't want to look athletic, I don't want to look muscular, and where does that come from? again, the whole idea that a woman has to, look a certain way, she has to have that hourglass figure. Anything that deviates from it, not pretty, not nice. So I think that has a larger social issue also.
I
Just
think
used
most
to
of the
do
people who
home
say
chores.
that they become bulkier on lifting weights haven't actually tried lifting weights.
I always tell them,
They just
give it a try with
Yeah.
very small weights, nothing very, the larger, as you were telling, ki weight lifting hi kar lo. Not something of that sort, but something that will create a resistance to what the strength is right now. That will create the change, and that will just help them to tone up.
I don't think we can do justice to this topic yet because it's so
can
much
just go
more.
on and on and on,
I want to speak so much more about it, but I'm gonna let you guys speak.
See, I'm just sticking to the rules of the game. 80% of people with osteoporosis are female. Yeah, it's actually right because two ends of the spectrum. Firstly, premenopausal age, if you consider, they are not, but postmenopausal, most of the women are exposed to osteoporosis, are at the risk of getting osteoporosis. Basically, where your bone mineral densities goes low because of calcium deficiency, vitamin D deficiencies. Menopausal age, you're all the more at risk because of estrogen, which is very essential for calcium absorption and calcium metabolism. So
it is more of how well you have treated yourself in the rest of the life that you have already gone through. So that's why
When she said that, it depends on how you have managed your previous
Earlier
years. I'm thinking 10, 20 years of my life, I think I've binged on junk.
yeah, because females, we go through quite a lot of changes. Say from puberty to getting married to delivering a baby to coming to this menopause wala thing. Everything requires a great inflow of nutrients, which is mostly just gone without noticing, or it is like आगे देखेंगे अभी ज़रूरत नहीं है. I'm all good and I'm all fine from the health perspective.
Women's digestive health differs from that of men. Yes, for sure. Because women go through so much of overthinking, anxiety, and the hormone game playing around. Definitely, that affects the gut quite a lot. Gut is the second brain of our body. So if that is not falling in place, that will definitely disrupt quite a lot of physiology, and also that is related to stress, your physical activity, and your nutrition.
adding to that, I think in a family, if you consider, women tend to eat last. They tend to take care of others first, and then she'll make sure her children have eaten all, and husband or whatever.
Everybody is first.
And then so the time at which she has a breakfast, lunch, and dinner maybe differs, and then also the choice of food. There may be fruits at home, but she may not have it because she doesn't have time for it, or she thinks something else is more important than eating. So just like you mentioned, we have enteric nervous system in our gut. So that's why they ask you, do you have the gut feeling?
feeling.
That's because,
Yes.
apart from brain,
That gut feeling.
so that gut feeling is because of that. And definitely the digestive system differs because anxiety and especially during menstruation, many people attribute it to premenstrual syndrome, where your hormones are going crazy, and then a lot of women have loose stools, diarrhea during their menstruation, and a lot of them have mood changes, indigestion, tummy pain, nausea, vomiting during their premenstrual days. So definitely yes.
Oh wow.
Oh, this is mine only. Women experience and express different emotions. Okay. So I think here when it comes to the gender part, both men and women have the capacity to express, because there's a myth that women are more emotional or they feel more, but actually that's not true. There is no significant difference that has been found between the two genders. But when it comes to the nature of emotional responding, there is a difference. For example, women tend to express more sadness, fear, guilt, shame, while men tend to express more of anger and other hostile emotions. Okay, and the other interesting part is that how do they manifest in men and women? So men can be more aggressive, impulsive when it comes to expressing, while women will be more ruminative. They will keep thinking to themselves, or even if they are angry, they will be more passive.
I don't know. I take your seat as a psychologist right now, but I also feel it's more to do with the way they're brought up to say that, hey, you can express anger and you can't express anger, and which probably makes the women that they can't even express that.
No, and I think there is labeling as well. You know, one example that always comes to my mind is, imagine, you know, a ground where a very competitive sport is being played. And there are a crowd of men and women watching it. And a man suddenly starts crying or is, you know, angry for the other team to have won. What is the typical reaction? Arey, kitna passionate hai. You know, it's never like, okay, angry hai ya fir emotional hai. It's about passionate hai. But the same thing when a female does, how is it perceived? Oh my god, dramatic, hysterical.
Yeah.
So those labels also, I think, somewhere influence whether women will readily express something like anger, or do men feel safer to do so?
Women live longer than men. Most of the women in my life have lived longer than men, so yeah, women live. I think they do. But biologically speaking, I think Dr. Ramya will say better. Estrogen. Estrogen.
No answer to this question. I really have nothing to put into it.
It actually, I think the race and genetics matters a lot. It's not like
Females do live longer, but I cannot pinpoint on the points where nutrition could play a role, or genetics, or the makeup of the body can play
I
a
think
big role.
it's whether men or women who choose better lifestyle live longer. It's not
No, but what?
definitely not the gender.
What about estrogen? Estrogen has that protective.
Estrogen doesn't have a protective thing on your life. On your
Expectancy?
soul.
I don't
it's
know.
only on certain fat tissues like fat and maybe bones and other metabolism, but definitely not how much you breathe in your life. So I think it's the kind of lifestyle that you choose that really makes you live longer than the gender or the genetic composition as such. Somebody whose father has lived 100 years or 90 years, the son could live, he could die in 50 or 60 years, or daughter could live up to 90 years. It's entirely up to the lifestyle they choose.
You put it as a myth.
But it was yours.
It's okay.
Again.
We empower each other at Even, so it's fine. You can do that for me.
Yes. Alright, so women have unique heart attack symptoms. Yes, because the presentation of heart attack in men is more typical of your textbook definition of a heart attack symptom. They tend to have mediastinal pain, reading to left hand, and more of left-sided chest pain. Unlike women who can present it in a very vast variety of symptoms like nausea, vomiting, radiating pain to the jaw, you lose stools, and giddiness, and then tiredness, excessive sweating, breathing difficulty. Even men can present this way, but it's more women who present it in a lot different way compared to the typical textbook symptom. Yeah, and also they tend to ignore, thinking that it could be their common gastritis symptoms.
Yeah, I was coming to that. Women will just sideline it very comfortably. It's okay, that happens sometimes to me. That's the way they come up.
Anyways, at Even we are proactive and screen, and our MC Kinkoff consult, actually we take in detail consultation about their previous history and medical history and a lot of things. I think we should be able to help them in a much better way.
मैंने बचा लिया.
Okay, great.
Yeah.
Okay.
Women have different nutritional needs. Yes, for sure. Because the way the woman is physiologically made, or the way the female body is, which goes through quite a lot of changes through the lifespan, the nutritional requirement at different life or that event is very different than what a male counterpart needs. Okay, so simply putting it is with the calcium, iron, or folic acid needs that women go through almost whole of their life, that is needed as a supplementation or as an upper hand in the day-to-day eating that they do.
From hormonal perspective, because we have estrogen, testosterone, progesterone influencing our body to a greater extent, seed cycle and specific diet may not hold good for men because they do not have the kind of hormones that we have. So definitely, the nutritional requirements that they have in specific is completely different.
Yes.
We are playing with fire here. उसका
This hand you-
structure देखो.
हाँ वो नहीं. We'll pick up this.
And it's the same,
You pick up this. Don't you pick up this.
What is the? What do we have to do?
Yes.
Yes, we
refer a lot,
do.
actually.
Yes.
I
Refer also in personal.
There's a lot
also
of
we-
cross references happening.
Yeah.
Because that's the whole point of even, right? That's the whole point of saying that, hey, we want you to get better. We trying to help you once you get something is different. But we want to help you not get there at all. So that is the why.
Yes.
That's why we have a psychology section, nutrition section, general physicians, physios, EPs. The whole point is to have a holistic approach to any condition.
Yeah. Parallelly, if you see, we're also playing Jenga games in real life. So we pick up blocks and then we refer.
This is the mess that everybody is there in life. And you just have
let's
to
arrange
build it up with all the things putting in place from psychologists, doctors, nutritionists, physiotherapists, and it will stand erect and for a longer period of time.
Yeah. And it's okay to be Tera Mera also.